Introduction of microcrystalline cellulose powder or MCCP as a better alternative to sugar of milk and cane sugar as dispensing vehicle for potentized medicines is an outcome of MIT scientific redefining of homeopathy. Actually, it is one of the great updations that happened in homeopathy since the period of Samuel Hahnemann. It may take some time for homeopathic community to recognize its revolutionary implications, but it will happen gradually. Potentized homeopathic medicines are currently dispensed as vials of medicated sugar pills, or by putting 1 or 2 drops into sugar of milk powders or blank tablets. Use of cane sugar and sugar of milk in homeopathic pharmacy is equivalent to use of various excipients in modern pharmaceutical industry. An excipient is generally a pharmacologically inactive substance formulated with the active ingredient of a medication. Excipients are commonly used to bulk up formulations that contain potent active ingredients, thus often referred to as bulking agents, fillers, or diluents, to allow convenient and accurate dispensation of a drug substance when producing a dosage form. They also can serve various therapeutic enhancing purposes, such as facilitating drug absorption or solubility, or other pharmacokinetic considerations. Excipients can also be useful in the manufacturing process, to aid in the handling of the active substance concerned, such as by facilitating powder flowability or non-stick properties, in addition to aiding in vitro stability such as prevention of denaturation over the expected shelf life. The selection of appropriate excipients also depends upon the route of administration and the dosage form, as well as the active ingredient and other factors. Pharmaceutical regulations and standards require that all ingredients in drugs, as well as their chemical decomposition products, be identified and shown to be safe. Sugar pills commonly used for homeopathic dispensing are made of cane sugar or sucrose. Sucrose is an organic compound belonging to the class of carbohydrates, commonly known as table sugar and sometimes called saccharose. A white, odorless, crystalline powder with a sweet taste, it is best known for its role in food. The molecule is a disaccharide composed of the monosaccharides glucose and fructose with the molecular formula C12H22O11. Milk sugar or lactose is the most prominent substance currently used as homeopathic drug dispensing vehicles. It is used in the form of tablets or powders of different sizes, which are medicated by adding potentized homeopathic drugs. It is a disaccharide sugar found in milk. It has a formula of C12H22O11. Lactose is a disaccharide derived from the condensation of monosaccharides galactose and glucose, which form a beta-1,4 glycosidic linkage. Its systematic name is beta-D-galactopyranosyl 1,4-D-glucose. The glucose can be in either the alpha-pyranose form or the beta-pyranose form, whereas the galactose can only have the beta-pyranose form, hence beta-lactose and beta-lactose refer to a numeric form of the glucopyranose ring alone. Lactose is hydrolyzed to glucose and galactose, isomerized in alkaline solution to lactulose, and catalytically hydrogenated to the corresponding polyhydric alcohol, lactitol. Lactose crystals have a characteristic tomahawk shape that can be observed with a light microscope. Lactose is a disaccharide. It is a sugar composed of galactose and glucose. Lactose makes up around 2/8 of milk by weight. The compound is a white, water-soluble, non-hygroscopic solid with a mildly sweet taste. It is used in the food industry. Theoretically, an ideal dispensing vehicle should be a substance with following properties: 1. It should not be a drug substance by itself. 2. It should be chemically inert. 3. It should not interacting with drugs. 4. It should be indigestible. 6. It should not be not absorbed into the body. 7. It should not have any long-term or short-term toxic effects. 8. It should not have any nutritional or caloric value. Both lactose and sucrose are included in homeopathic materia medica after conducting elaborate drug provings, symptoms of which show they are powerful medicinal substances having actions upon diverse biological pathways when introduced into living bodies. Both of them are chemically very reactive, capable of interacting with various chemical substances. As such, they can interact with drug molecules also. They are hydrolyzed into their subunits by the action of digestive enzymes, and absorbed into blood. Symptoms obtained from drug proving themselves show that both of them may have diverse kinds of short-term and long-term toxic effects in living organisms. Both sucrose and lactose are converted into glucose when digested, and as such, they have nutritional as well as caloric values. Based on the above definitions, it is obvious that sucrose and lactose, used in homeopathic pharmacy, are not ideal dispensing vehicles. Cellulose seems to be a better choice for dispensing homeopathic medicines, when compared to sugar of milk and cane sugar. Cellulose is an organic compound with the formula C6H10O5N, a polysaccharide consisting of a linear chain of several hundred to over 10,000 D-glucose units. Cotton fibers represent the purest natural form of cellulose, containing more than 90 of this polysaccharide. In many ways, cellulose makes the ideal excipient for pharmaceuticals as well as food articles. A naturally occurring polymer, it is composed of glucose units connected by a 1,4-beta-glycosidic bond. These linear cellulose chains are bundled together as microfibrils spiral together in the walls of plant cell. Each microfibril exhibits a high degree of three-dimensional internal bonding, resulting in a crystalline structure that is insoluble in water and resistant to reagents. There are, however, relatively weak segments of the microfibril with weaker internal bonding. These are called amorphous regions but are more accurately called dislocations since microfibril containing single-phase structure. The crystalline region is isolated to produce microcrystalline cellulose. Cellulose is an organic compound with the formula C6H10O5N units. Cotton fibers represent the purest natural form of cellulose, containing more than 90 of this polysaccharide. In many ways, cellulose makes the ideal excipient for pharmaceuticals as well as food articles. A naturally occurring polymer, it is composed of glucose units connected by a 1,4-beta-glycosidic bond. These linear cellulose chains are bundled together as microfibrils spiral together in bonding, resulting in a crystalline structure that is insoluble in water and resistant to reagents. There are, however, relatively weak segments of the microfibril with weaker internal bonding. These are called amorphous regions but are more accurately called dislocations since microfibril containing single-phase structure. The crystalline region is isolated to produce microcrystalline cellulose. Microcrystalline cellulose is a term for refined wood pulp and is used as a texturizer, an anti-caking agent, a fat substitute, an emulsifier, an extender, and a bulking agent in food production. The most common form is used in vitamin supplements or tablets. It is also used in plaque assays for counting viruses. I have been doing some experiments in homeopathic dispensing by using cellulose, both as cotton fibers as well as commercially available microcrystalline cellulose. Small quantity of pure cotton fibers were moistened with potentized drugs selected as similimum, and kept until it is dried, and advised the patient to keep it under tongue for some time. It acted very promptly, much better than when administered by other conventional means. By keeping under tongue for extended periods, the molecular imprints adsorbed in the cotton get gradually released, thereby ensuring appropriate exposure and availability. We can apply medicated cotton also as wound dressing, and to cover skin lesions as eczema. Medicated cotton has been used as anal plugging in hemorrhoids with promising results. Microcrystalline cellulose or Microcrystalline is commercially available in the market in tablet forms, which could be moistened by potentized drugs and kept for long periods. They also gave excellent results in my experiments. Homeodispor Ultra Purified Pharmaceutical Grade Microcrystalline Cellulose Powder IP is a better alternative to cane sugar and lactose for dispensing homeopathic medicines. One of the wonderful properties of microcrystalline cellulose powder is its extraordinarily high adsorption capacity. 1 gram of MCCP can adsorb and hold more than 1 milliliter potentized drug. In the picture shown above, I have taken 20 grams of MCCP in a vial and added 20 milliliters of potentized drug. Still it remains dry, powdery, uncaked and free-flowing. This high adsorption capacity is one of the reasons why I am saying MCCP is superior to lactose and cane sugar for using as homeopathic dispensing vehicle. MCCP is chemically inert, and will not interact with water or alcohol contained in potentized drugs. It simply adsorbs the medicines onto the periphery of microcrystals of cellulose. Once put in the mouth, MCCP easily disperses into individual microcrystals and releases the whole medicinal content into buccal cavity, wherefrom it is absorbed into bloodstream through the walls of buccal capillaries. Since our digestive enzymes cannot split cellulose into constituent glucose molecules, MCCP passes through the intestinal tract totally undigested. As such, MCCP has no any nutritional or caloric value, unlike lactose and cane sugar, which are digested and absorbed into the system as glucose. Obviously, MCCP is more safe to diabetic patients. This factor also makes MCCP an ideal dispensing vehicle. Microcrystalline cellulose is a term for refined wood pulp and is used as a texturizer, an anti-caking agent, a fat substitute, an emulsifier, an extender, and a bulking agent in food production. The most common form is used in vitamin supplements or tablets. It is also used in plaque assays for counting viruses. Microcrystalline cellulose powder is subjected to an ultra-purification process to make pharmaceutical-grade MCCP IP, which is distributed as Homeodisp. Experiments have been conducted in homeopathic dispensing by using cellulose, both as cotton fibers as well as microcrystalline cellulose powder MCCP. Small quantity of pure MCCP were moistened with potentized drugs selected as similimum, and kept until it is dried, and advised the patients to keep it under tongue for some time. It acted very promptly, much better than when administered by other conventional means. By keeping under tongue for extended periods, the molecular imprints adsorbed in the microcrystalline cellulose gets gradually released, thereby ensuring appropriate exposure and availability. Since our digestive enzymes cannot break the cellulose into glucose, MCCP is safer to be administered even to diabetic patients. MCCP under the trade name Homeodisp is available in powder as well as tablet forms. Responding to my proposition that MCCP could be a superior substitute to lactose and cane sugar as dispensing vehicles for potentized homeopathic drugs, many friends asked me to provide more details regarding the safety studies of MCCP. Hence I am quoting here the World Health Organization report on microcrystalline cellulose, prepared by the 49th meeting of the Joint FAO-WHO Expert Committee on Food Additives (GECFA), World Health Organization, Geneva 1998. First draft prepared by Dr. J.B. Grieg, Department of Health, Skipton House, 80 London Road, London, SC 16 litres width, UK. This report contains a detailed overview, evaluation and comments upon hundreds of studies done regarding biochemical aspects, absorption, distribution and excretion, acute toxicity of microcrystalline cellulose in animals, short-term toxicity studies, long-term toxicity carcinogenicity studies, reproductive toxicity studies, special studies on embryotoxicity and teratogenicity, special studies on genotoxicity, special studies on sensitization, special studies on skin and eye irritation, special studies on effects of cellulose fiber on tumor growth, toxicity consequent to substance abuse, changes in gastrointestinal function and nutrient balance, etc., with complete references. The committee concluded that the toxicological data from humans and animals provided no evidence that the ingestion of microcrystalline cellulose can cause toxic effects in humans when used in foods according to good manufacturing practice. The committee concludes the report with the following statement: absorption of microcrystalline cellulose was reported in various species, which included rats, in early studies. A recent study in which a special fine particle size preparation of microcrystalline cellulose, median diameter of particles 6 micrometers, was administered orally to rats 5 gram per kilogram body weight per day for 90 days has failed to confirm the earlier observations. In this study, precautions were taken to ensure that, at autopsy, There was no cross-contamination of the tissues with fine particulate matter. In various parenteral studies of the acute toxicity of microcrystalline cellulose in animals, there have been signs consistent with a tissue response to foreign particles. Similarly, microcrystalline cellulose has been associated with the formation of granulomas in human lung when it has been injected intravenously during drug abuse. No such lesions have been described as a consequence of oral ingestion of microcrystalline cellulose by rats or humans. In 90-day toxicity tests during which microcrystalline cellulose was administered to rats in the diet at concentrations of 2.5 to 50, increased consumption of food to compensate for the content of this material was observed. Although this may have some effects on mineral absorption, there was, in general, no compound-related systemic toxicity. The NOEL exceeded 50 grams kg diet, at which dose level the mean intakes of microcrystalline cellulose by male and female rats were 3.8 and 4.4 grams per body weight per day, respectively. A 2-year feeding study of microcrystalline cellulose in rats was brought to the attention of the committee. Despite a lack of evidence of toxic effects, the committee considered that the execution and reporting of the study were not adequate to identify an OL. In vitro and in vivo genotoxicity studies were negative. In a 3-generation reproductive toxicity study in rats that had been reviewed by an earlier committee, there were some effects of using 30 microcrystalline cellulose in the diet. These had been considered to be a consequence of the quantity of material reducing the energy density of the diet. However, in recent embryotoxicity and teratogenicity studies in rats, there was no evidence of compound-related effects at dietary levels up to 50 grams of microcrystalline cellulose per kilogram diet equal to 4.6 grams per kilogram body weight per day, given on days 6 to 15 of pregnancy. In some human studies there have been reports of alterations to gastrointestinal function following ingestion of microcrystalline cellulose. The changes do not appear to be related to systemic toxicity. Microcrystalline cellulose is a purified, partially depolymerized cellulose prepared by treating alpha cellulose, obtained as a pulp from fibrous plant material, with mineral acids. The degree of polymerization is typically less than 400. Not more than 10 of the material has a particle size of less than 5 nanometer. Insoluble in water, ethanol, ether and dilute mineral acids. Slightly soluble in sodium hydroxide solution. Microcrystalline cellulose C6H10O5N is refined wood pulp. It is a white, free-flowing powder. Chemically, it is an inert substance, is not degraded during digestion and has no appreciable absorption. In large quantities it provides dietary bulk and may lead to a laxative effect. Microcrystalline cellulose is a commonly used excipient in the pharmaceutical industry. It has excellent compressibility properties and is used in solid dose forms, such as tablets. Tablets can be formed that are hard, but dissolve quickly. Microcrystalline cellulose is the same as cellulose, except that it meets USP standards. It is also found in many processed food products, and may be used as an anti-caking agent, stabilizer, texture modifier, or suspending agent among other uses. According to the Select Committee on Grass Substances, microcrystalline cellulose is generally regarded as safe when used in normal quantities. The most common form is used in vitamin supplements or tablets. It is also used in plaque assays for counting viruses, as an alternative to carboxymethylcellulose. A naturally occurring polymer, it is composed of glucose units connected by a 1,4-beta-glycosidic bond. These linear cellulose chains are bundled together as microfibrils spiral together in the walls of plant cell. Each microfibril exhibits a high degree of three-dimensional internal bonding, resulting in a crystalline structure that is insoluble in water and resistant to reagents. There are, however, relatively weak segments of the microfibril with weaker internal bonding. These are called amorphous regions. Some argue that they are more accurately called dislocations, because of the single-phase structure of microfibrils. The crystalline region is isolated to produce microcrystalline cellulose. Approved within the European Union as a thickener, stabilizer or emulsifier as microcrystalline cellulose was granted the E number E460I with basic cellulose given the number E460. Microcrystalline cellulose MCC is pure partially depolymerized cellulose synthesized from alpha cellulose precursor. The MCC can be synthesized by different processes such as reactive extrusion, enzyme-mediated, steam explosion and acid hydrolysis. The later process can be done using mineral acids such as H2SO4, HCl and HBr as well as ionic liquids. The role of these reagents is to destroy the amorphous regions remaining the crystalline domains. The degree of polymerization is typically less than 400. The MCC particles with size lower than 5 micrometers must not be more than 10. The MCC is a valuable additive in pharmaceutical, food, cosmetic and other industries. Different properties of MCC are measured to qualify its suitability to such utilization, namely particle size, density, compressibility index, angle of repose, powder porosity, hydration swelling capacity, moisture sorption capacity, moisture content, crystallinity index, crystallite size and mechanical properties such as hardness and tensile strength. Thermogravimetric analysis (TGA) and differential thermal analysis (DTA) or differential scanning calorimetry (DSC) are also important to predict the thermal behavior of the MCC upon heat stresses. Microcrystalline cellulose is a widely used excipient, an inert substance used in many pill and tablet formulations. As an insoluble fiber, microcrystalline cellulose is not absorbed into the bloodstream, so it cannot cause toxicity when taken orally. In fact, it is so inert it is often used as a placebo in controlled drug studies. However, some side effects have been noted in animal studies, although usually at much higher dosages than would be normal for a human subject. It is quite obvious from the above observations that microcrystalline cellulose powder or MCCP is an excellent better alternative to cane sugar and milk sugar as dispensing vehicles for potentized homeopathy drugs. Homeopathy community as well as official authorities should realize this fact, and include it curriculum of homeopathy pharmacy education. It will raise homeopathy to a new scientific level.